Hello guys, welcome back to our channel. Hoping everyone is fine and doing great. In this video we will talk about glomerular disease. So let's talk about nephritic syndrome first. Here this I stands for inflammation. That means this inflammation is occurring inside your glomeruli because we are talking about glomerular disease. You can simply say that this inflammation is happening inside your kidney, and the inflamed kidney will give you blood inside your urine, and that known as hematuria. Hemat means blood and urea means urine, and the hallmark feature of hematuria is RBC cast. Why do we call it RBC cast? Because when RBC passes through nephrons, nephron pack it inside a protein, and that packed RBC known as RBC cast. It can be this dysmorphic RBC as well, cause your nephrons is narrow, right? And while passing through this narrow tubule, your RBC shape can be changed. And because of inflammation in kidney, your kidney won't produce sufficient amount of urine, so there will be less urine output, and that condition known as oliguria. Oligo means few and urea means urine. And due to the inflammation in kidney, your body will retain sodium and water inside blood, cause your kidney is unable to filtrate properly, so there will be retaining of sodium and water, and this can cause hypertension and periorbital edema as well, right? This edema can be generalized, but in case of nephritic syndrome, periorbital edema is a characteristic feature, so I wrote it here, so don't mind it. And let's talk about azotemia. Still, the cause is inflammation, and due to the inflammation, your kidney is unable to filtrate properly, and that's why in your blood creatinine and burn will go high, and that's increased creatinine and burn can cause azotemia, right? And this azotemia leads to renal insufficiency or renal failure. And here low grade proteinuria will be there. You can find protein inside your urine in nephritic syndrome, but it will be less than 3.5 gram per day. That's why we called it low-grade proteinuria. Let's look at some example of nephritic syndrome. First, post-streptococcal GN. GN means glomerulonephritis, rapidly progressive GN, IgA nephropathy, and Alport syndrome. That's all about nephritic syndrome. You just need to remember this I for inflammation, and you can automatically claim this features, right? Now let's talk about nephrotic syndrome, which indicates protein loss. And here we can see this spelling of nephrotic, right? RO is common in protein, which will make you memorize that nephrotic syndrome belongs to protein loss, and it will be heavy protein loss, massive protein loss, more than 3.5 gram per day. Let's look at some feature of this syndrome. There will be hypoalbuminemia, cause you are going to lose your albumin through your urine. That's why there will be less albumin inside your blood, and due to less albumin, your oncotic pressure will going to fall, and your liver wants to maintain it, so liver will produce more lipids, so there will be hyperlipidemia, right? And there will be hypogammaglobulinemia as well. Gamma globulin is also a plasma protein which is going to be lost in this syndrome through your urine, so there will be hypogammaglobulinemia. And the last feature is hypercoagulability. So hypercoagulability will be there because you are going to lose your antithrombins through your urine, so there will be more thrombin inside your blood, and it will responsible for thrombosis, and this will responsible for hypercoagulability. Okay, now let's look at some disease, some example of nephrotic syndrome. MCD, that means minimal change disease, membranous glomerulonephritis, focal segmental glomerulonephritis, and MPGN, that means membranoproliferative glomerulonephritis. That's all about nephrotic syndrome. In this video, we saw nephritic and nephrotic syndrome. I hope you get something from this video.